With the influenza season almost upon us, the Department of Health has urged citizens to take extra precautionary measures to protect themselves. In a statement, the department has revealed that the Respiratory SINCI-shal virus is currently at peak circulation in the country, while the influenza virus infections are also starting to increase. To discuss this further is Dr. Sibongiseni Dhlomo, Deputy Minister of Health. Doctor, good evening and thank you very much for your time. I must say it was quite comforting to read that indeed there is a virus in the air, because lots of parents have been saying their children have been hospitalized after displaying COVID-like symptoms. Talk to us about this respiratory disease, SINCI-shal, and the symptoms thereof.
Good evening, ma'am, and good evening to your viewers. You might just get some disturbance now and I'm taking a call in the airport. Yeah, we are in a very opportune moment right now because according to the WHO calendar, 24th until the 30th of April is what we call an Africa Vaccination Week. So we are actually increasing the awareness about vaccines, generally all of our vaccines, especially on children. You would recall, ma'am, last year we had an outbreak of measles in some pockets of our country, and that was due to having had the COVID really damping up our fight against all illnesses. So we had to then restart and improve on that with these gaps that were showing because of COVID. But right now, we know seasonally, during winter times, there is an increase of a particular strain of a virus. This one, you are correct, is Respiratory SINCI-shal virus that is really affecting our citizens. So we are calling upon all our citizens, especially the pregnant mothers, the elderly above age 65, young children, those with comorbidities, hypertension, diabetes, to get a lung disease, to come forward and visit all our health facilities. We do have this vaccine available free of charge. Our non-communicable disease institute has indicated to us, the National Institute of Non-Communicable Disease, that there is this respiratory SINCI-shal virus that is circulating. So we need to up our vaccines for that, for this high-risk group that I've mentioned, ma'am.
Doctor, can you just take us through the symptoms? Because it seems people are struggling to distinguish between this particular virus and COVID. Because even some colleagues have said they think COVID is now, we're seeing a surge in COVID numbers all over again.
We would have given you that alert, ma'am, through our National Institute of Communicable Diseases. They have actually got the strain, hence we are able to call the name Respiratory SINCI-shal virus, RSV. Now, it is not a COVID. There will not be any difference in terms of presentations. All of them will be a flu-like illness, tiredness, cough, blocked nostril, sore throat, general pain, muscle pain because the compromise of oxygen getting to the muscles and all that. So you will not be able to say, oh, I do have COVID or I don't have COVID. All we can indicate now that with the immunization, vaccination that took place around the COVID period, we have a relatively stable society in terms of that, in terms of immunity, and we have still circulating COVID, but very low levels of COVID circulating. It's not a strain that is giving us this challenge now. It is this RSV, as indicated by the National Institute of Communicable Disease, and therefore we have a specific vaccine to support us to make sure that these identifiable risk group societal members are taken care of.
And for ones who just want to take precaution but don't necessarily fall into this group of the pregnant or those above 60, they're more than welcome to also get vaccinated.
Yes, they can. People who have had some operations in the past, the removal of a splenectomy. But, ma'am, we will not prioritize you and myself when we get into the clinic because we do have some measures of how many children we have in the country, if they all were to come for it, how many elderly we have in the country, how many of the people who have hypertension, diabetes, comorbidity. So we may not give you a priority, but look, we will not deny you if you also come and want to be given this vaccine, even though we want to prioritize a specific target: children, pregnant mothers, citizens who are elderly, citizens with comorbidities. That is our focus area, at least as we start.
Now, Doctor, before I let you go, I do understand you need to board a plane. Last week, the ministry updated us on the state of the public health. Among the issues revealed was the 2012 unfunded post for doctors, which requires around 2.4 billion. What is the plan on these unfunded posts? There are varied responses as to provinces, as we are getting National Treasury supporting some of the other provinces that have actually they are well advanced in terms of having advertised and having actually filled those posts. I'm aware of some provinces that are continuously engaging and getting those processes completed. And I was actually getting a confident report from our Director General that quite a significant number of the medical officers who actually have applied will be actually taken care of. I may not be able to update you now as to whether we have completely done with that process, but it was underway. You'd recall that there was a meeting bilateral between our minister and the Minister of Treasury, and those issues to say, Minister Pasha, how many doctors do you need to be employed? And those discussions have therefore yielded a situation where the National Treasury was able to support us, and therefore that was distributed to provinces to say, okay, those numbers that are coming in from province A, B, C, D, we have this support that is coming into yourself. Please advertise and get going. So they may not all of them have actually taken the jobs, but the processes of advertising, interviews, and all that is underway. All right. Deputy Minister, thank you very much for your time this evening. That's Dr. Sibongiseni Dhlomo, Deputy Minister of Health, speaking to us.